What's up, everybody? Carter Todd, President, Capital City Black Nurses Association. Thank you for tuning in to our Barbershop Health Talks, first installment of 2022. We had a great start last year. This year we look to bring 3 of the programs here from Sacramento, from Chicago, and all over the country, talking about Black men's health, lifting up the barbershop as a venue of cultural influence. We're really excited to be working with a lot of our partners here. As we get going, I want to give a shout out to some of our sponsors, UC Davis Health, Betty Irene Moore School of Nursing. I also like to recognize some of our partners here. We're an exclusive barbershop studios downtown here, Oak Park community. Thank you to Javier for allowing us this back room. Also, we've been working with our trap medicine compadres, working with I Am Health Impact, My Brother's Keeper Sacramento, and also our Brother Be Well platform that we've been consulting with over the last couple years. Really happy to be working with them to bring mental health resources for boys and men of color. As we talk about gun violence today for this installment, we'll really talk about how important the mental health aspect is of the fallout of this. So stay tuned with us. We have some great speakers lined up for you today. We have physicians, we have nurses, we have mental health practitioners, we have community members here to talk about what gun violence really does to us here in this community and ways to move forward. That's what I'm really excited about, is how do we continue to move forward so when these acts of violence happen, we're better prepared and to not let them happen again. Our first speaker today is going to be Dr. Ian Brown. He's going to be talking to us about the clinical aspect of gun violence and trauma-informed care. He works here in the Sacramento community, someone that I respect, that I've seen in the hospital working, and he's going to talk to us a lot about violent acts, and I'm excited to hear a little bit about what he has to offer.
Okay, my name's Ian Brown. I'm a trauma surgeon, trauma critical care. I work at University of California, Davis, which is right down the street here, so part of the community. My background, I grew up in Chicago, kind of Chicago area, and Maywood is a little suburb just right outside Chicago. That's where I'm from, and made my way out west, got my undergrad at Stanford, and went back home to Chicago, University of Chicago, did an MD, PhD there, came back out west to San Francisco, UCSF, trained to be a surgeon, and then made my way out here to Davis to do some critical care and trauma surgery.
Yeah. And I remember meeting Dr. Brown for the first time. He might not remember, but we had a patient, a gunshot victim over in the pediatric ICU probably about 4 or 5 years ago. So thank you for being here. Can you tell us a little bit about your wraparound program and some of your experience working with gun violence in the community?
Absolutely. So maybe about 5 years ago, we reinstituted a program that we call Wraparound. And so what that is that historically, when someone come into the hospital and they got shot or stabbed or injured in some sort of violent trauma, we would do the best we could to patch up the holes, get people back health-wise, and get them back, get them out of the hospital. That's sort of the old school, I guess, the derogatory way to say it would be treat them and street them, more or less. That's not enough. So it turns out that if you experience violent trauma, the rate of recidivism, or the chance that you're going to have another additional episode of violence-related trauma, can be as high as 40% in many communities. Wow. And so what we're doing is we're putting people back out that we've already identified as being at high risk for violence to the same situation that they started off with that predisposed them to violence. And in addition to that, like, they've already had violence, so they're scarred now, and so it's even worse in some ways. And so we have this program that more holistically treats a patient and addresses some of those social determinants that predispose somebody to violence, so that we can decrease those numbers and help people kind of go in a different direction. You might think of it this way. So if a person had a heart attack, they'd come into the hospital, and not only would they get their heart vessels opened up, but they would be put on a program that addressed their whole lifestyle, what they eat, how they exercise, all sorts of things like that, because they're already at risk for a heart attack. So now you're doing preventative stuff that addresses all the aspects of life that put them at risk. Well, you can do the same with violence. You can take a public health approach on an individual basis and address all those same life issues and help people and empower people to get to where they want to be, so that they're not at risk in the same way anymore.
Yeah, it's a great program. And before this, we were talking about some of the numbers of how many people do you see come through the hospital. What was that statistic you said daily. Was it roughly 2 a day?
Yeah, roughly 2 days. So we see probably about 800 overall cases of violence-related trauma a year, not including child abuse, non-accidental trauma, stuff like that. So it's a pretty high number. You can imagine that, if 40% of those patients are coming back, that's 320. That's almost one a day coming back.
Yeah.
And so I think that, that's a huge number.
Yeah.
Unfortunately.
So it sounds like you're doing a lot clinically. That's your expertise. You've trained a long time to be here, so we appreciate you. If you were to give a word to the community about kind of how to get through it, how do we move past these violent acts, what are some words of wisdom that you might instill on folks?
Oh, I probably would take a couple. So one thing is about sort of the culture of healing. And this is one thing that the wraparound program is built upon. It's cultural competency, understanding, and approaching people with a shared lived experience in a way that really reaches people that wasn't historically taken into account. So we're getting a lot better at that. And we're sort of attacking it from the inside too, because when you start to address the patients with that, the wraparound program not only addresses the clients, but it also changes the way the hospital system looks at violence-related trauma and has changed the culture around how we receive patients and what their hospital's experience is, and then what their post-discharge experience is.
Sure.
And so I think that that's critical. I think you have to start with a very humanistic approach. On the medical side, you'll see people sometimes say, oh, we're treating a gunshot wound. But you're not. You're treating a person who has a gunshot wound. And so it starts sort of within in that mindset and that culture change. And I think that that's been big. And I think that works not only in the hospital system, but also in the community. I think we have to realize how in touch we are and how much we see ourselves and our family in violence-related trauma, and how, we're connected. We're part of a community. It's not we're treating the people over there. It's our community, and we have to own it. And we have to decide what our attitudes are towards that. And we have to take an active approach towards healing that's a real holistic approach. I think that we have to eliminate stigma, issues, the mental health aspects, post-traumatic experience are very real and only starting to be addressed in a way that is adequate.
Yeah.
And so I think that we're making positive moves in that regard.
I'm glad you bring up the mental health side of it. We have some speakers a little bit later who are going to be touching on that part. And you talked about the impact in the community, the ripple effect from, the tragedy on April 21st. It was felt nationwide, right? The focus on Sacramento. But these violent acts happen all the time. Gun violence is something that, our communities have to live with, that we need to work through and improve in any way that we can. So I appreciate Dr. Brown for being here. I'm gonna let y'all know his wife is a nurse, so he's very tapped in with Capital City Black Nurses Association.
Absolutely.
Yeah, so thank you for your time, man. I appreciate it.
Absolutely. Thank you for having me over here.
All right.
Appreciate you.
Our next speaker today is going to be community member Ryan Banks. He's a local Mr. Everything here in Sacramento, part of the night scene, part of the party scene, and really just an engaged community member, a beacon of positivity through some of these tragic events here in Sacramento. So next up, we're going to hear some words from Mr. Ryan Banks. Tell us a little bit about yourself.
Like the gentleman said, my name is Ryan Banks. I've been living here in Sacramento since I was about 19 years old. I've been here for a while. I've always been active in the community. I've worked here in Oak Park at St. Paul for several events they had there. I've done toy drives. I've been really hands-on in the community whenever time permits. So a little bit about myself. I'm the general manager of London, Sacramento. Unfortunately, we were a block away from the last incident that just occurred 3 weeks ago. It's been a trying time.
Yeah.
So, yeah.
And I reached out to Ryan. I'd seen him through his IG handle, which he'll touch on a little bit later, but I was just really respected the way that he was moving initially, during, and after, right? Because these are traumatic events. It needs a call for the community to come together and be a resource for folks. And I say it all the time through Capital City Black Nurses is that, we are the help. We're here to help people get through things. And when these horrible incidences occur, ultimately it does fall on those in the community to lift us up and get through it. So
Definitely.
can you tell us a bit about on April 21st, kind of what that night was like for you and the days following?
So the night it happened, we were on a consecutive run of being sold out for about 2 months straight. When I say sold out, I mean like we're hitting max capacity by 11. We're having great nights, really showing the city that we people of color can come together, party, and have a good time and be safe about it. That night, I left right when we turned our lights on. We turned our lights on at exactly 1:19 a.m. 1:19 a.m. I left. I spoke to a couple of people. Actually, one of the victims who passed. I spoke to him right before I left, and I was leaving early that night because we were actually preparing for a brunch the next morning.
Got you.
So I had to be there the very next morning, and so by the time I got home, it was about 30 minutes later. Right when I, you taking your clothes off to get undressed, I got a phone call like, hey, after we closed, we heard gunshots outside. Just not regular gunshots, like a lot of gunshots.
Yeah.
So, I started getting dressed, getting ready to go back down there. And as I pull up, the police had the entire, you couldn't get nowhere close to it. So just the moments after that, I'm calling, checking on staff. Several of my friends were around the corner several of like my best friends were like around the corner from the incident when it happened. They were sheltering in place because, it was an active shooter. It's just the fear of the unknown. You don't know what's going on. You don't know if someone left their phone on the charger. I have a staff of 27 at the club. So it's like checking in with 27 different people, making sure everyone's accounted for, making sure everyone's okay. Then that's when you start hearing that, it's fatalities outside. Now it's like, I work outside of the club every weekend. So I see everybody who's out, all the regulars. Even the homeless lady who ended up getting killed, she was our resident homeless lady. You know what I mean? So like, just finding out those things is, it's such a tragedy because it's like, how do we avoid these things from happening if we can't even have a good time in our own city, and be safe? So.
And I appreciate you being able to open up about it because it's not easy, man. I can tell you're a leader in the community. You carry a lot on your shoulders, but to be able to unhash that trauma is a challenge. And we have people here that you can tap in with if you need any follow-up talks or discussions. So with that being said, I seen a lot of the way you were moving and being a resource and a beacon of positivity after, right? And I think a lot of people look to you for that. So what were some of the things that you implemented or some of the other programs or resources that were helping you either then and now to get through it?
Well, the first thing, after I checked to make sure everyone was safe and then, you're going through all these things, I reached out to a few of my friends who are, one of them in particular, her name's Jennifer Baker. She has her own private practice. She's a therapist. And she was like, hey, anyone personally affected by it, reach out to me and send them my way and I'll take care of it. So her and her office was able to, I believe we sent them about 12 people who were directly affected from the tragedy. I want to say thank you to them and their practice as well because, I feel like majority of the people in our community don't know how to open up and trust and talk to someone, and hash out, these types of traumas. And it was literally like, when I first posted about it, it kind of blew my mind how many people actually reached out to me.
Yeah, there was love on there.
There was a lot of love. Like so many people retweeted it or reposted it. And then me personally reaching out to the people I knew who were affected by it and actually being able to tell them, hey, like, this is me talking to you. Yeah. Like, you can trust me when I tell you, like, it's okay to go and get help. So, just building up those relationships on top of the previous relationships I already had with them was just the beauty and the tragedy type thing, you know, so.
Yeah, that's solid, man. And, Capital City Black Nurses, we've been partnered with Brother Be Well Project, mental health resources for boys, men of color, teenagers into adolescents. It'd be a perfect conduit of resources for folks for like right now.
Yeah.
Any last words you'd like to give us around gun violence or moving forward? Kind of what do you hope to see? Obviously nothing like this to ever happen again, but y'all are back outside. Yeah. I think that's great, to move past it, to not let this hold you down. Yeah. But where's moving forward?
Where's moving forward, I would just say that, if you feel like leaving your home, you're going to do something that you may regret, that may take you away from your family, just don't do it. At the end of the day, it was, I just went to one of the funerals yesterday, And just to see how many people that one death affected, it really rocked me to my core. So moving forward, I would just say that if you're not prepared for those type of life choices, just stay home. Stay home, figure it out, talk to someone, and find a different path, because this isn't it, and we need to do better.
Ryan Banks, I appreciate you, bro. Thanks for pulling up on a
Anytime.
Saturday. Busy man,
Big.
giving back to the community. Next up, we'll have our next participant. So again, this was Carter Todd, Capital City Black Nurses Association, Sacramento chapter of the National Black Nurses Association. We do invite you to scan the QR code in the bottom right side of the screen, fill out the survey, let us know how we did, let us know the ways that we can improve, and really continue to bring these resources and installments via the Barbershop Health Talks. Like I said, this is the first of many installments this year. We look forward to working with our partners, Trap Medicine, My Brother's Keeper Sacramento, the Brother Be Well platform over the next year. We'll be taking this platform out to Chicago in July, so stay tuned with us. Follow us on our Instagram, our Facebook, our LinkedIn, and we'll be premiering this video here shortly. Travis Nelson is our next guest, a marriage family therapist here in Sacramento, California. He's really engaged with the community. He's been excited to jump on our platform here with the Barbershop Health Talks. He'll be talking about the mental health aspects of gun violence and the fallout. So with no further ado, I'll let you introduce yourself.
All right, thank you very much, Carter. Thanks for having me, man. Appreciate you. This is a rare opportunity. I think we all should take advantage of this opportunity to have this platform to talk about these things. So my name is Travis Nelson. I'm a father of two boys, 23 and 21 years old. And they went to school here in the Sacramento neighborhood, Sacramento High, as a matter of fact. I'm going to put names out there, but very successfully graduated. But they've lost about 7 friends to gun violence in the span of maybe 3 to 4 years. They weren't in gangs themselves, but their friends, you know, of course, are from the area. So my fear was that they would get caught up in that movement. So the trauma that, even with my sons being present with me there, I saw how it affected my youngest, especially where he saw more gun violence. I'm also a retired Army captain, so and I've been in Iraq and fought in the Iraq War. But I think my son has seen more gun violence going to Sacramento High in Oak Park, Sacramento, unfortunately, right now. So that has motivated me to speak out as many opportunities as I can. I'm also a mental health professional. So I've worked everywhere, to include a psychiatric facility. But what I wanted to talk today and share with us today is about, it's not just gun violence is an outcome, it's a byproduct, I think, of a bigger issue. And the bigger issue, I believe, is definitely about what happens at home. So there's a theory out that's been researched and empirically researched and proven to be true about how we develop these core beliefs based on our experiences growing up. How does a barber learn to be a barber? Another barber teaches him. How does who was the first doctor? I don't know, but somebody had to teach somebody.
Army? See one, each one, teach one. What's the saying?
Reach one, teach one. But that's yeah. Absolutely, man. So the research shows that we develop these ideas of what a belief, a core belief, or a core value. And that means what we believe to be true about the world around us. And that means our political views, our religious views, how we should engage with each other, what a healthy relationship looks like. Because there's no model right now of what an actual relationship should exactly look like. Because there's no two people on this planet that are just alike. So what works for one family or relationship may or may not work for another relationship, because you have two different individuals. But then the research also shows that we pick up different beliefs and values from what we're exposed to in society, right? You talk about Instagram, you talk about if you're raised in the streets violence. You know, I lived in East Oakland, but mom put us in private school in Berkeley. You know, so, and tried to keep us away from that. But all that to say, though, there is no standard. We even had a model on social media that we all looked up to. Those black families we saw on TV were so rare and so strong, and then we found out in real life these people are just human as us, as you and me. So you know, it's all about what we teach our kids is what they emulate. So what are we teaching them, right? And where did we learn that lesson from? What we're teaching, where did we get our own core values and beliefs from? Are they cultural? Are they spiritually led? Are they led by, if you're in the streets, is it to survive, right? I saw there's those little fish bowls they have at the fair with the little, the kids can win for a prize. Little goldfish bowls, right? Little clear bowl, maybe some crystal blue rocks, a little 2-story green castle in there, a little pretty fish. The kid takes it home, puts it on the shelf, swims around, it gets fed, water's changed. Years and years, this fish swims in this beautiful scenery. Now, suppose this fish wants to engage with another fish in a different fish bowl, right? That could be a wife, that could be a brother, that could be enemy or friend. And say, hey man, don't you love how the water glistens off these green castles? And the other fish says, man, castles are blue. What are you talking about? I've been swimming around years and my castle's blue. No, man, castles are green. No, bro, castles are blue. Man, I'm on the 2nd floor looking out the window. The mermaid tells me how good the water looks on my green castle. The other fish says, man, what's a mermaid? I know what a turtle is, but I don't know what a mermaid is. So we all engage with each other from these different belief systems that we grew up with and we were exposed to all our years. Now imagine them taking them out of those fish bowls and putting those 2 fish with green castles and blue castles all their lives, and they're arguing about which color castles are, and they put them in a fish tank where there's other fish from other fish bowls with other experiences. And ain't no castles at all. Now there's a whole mountain scenery, right? Right? And then, let's take them out and put them into a lake or a river or a stream. Or how about one of our oceans where there's all these different fishes from different experiences that we try to engage with based on what we believe to be true. Conflict usually comes when we misinterpret other people's behaviors. And the research shows that we misinterpret those behaviors based on what we believe to be true. A Christian seeing somebody going into a club might think differently than somebody that's not a Christian seeing somebody going into the club. But the statistics shows that in 2020 that there has been a significant decrease or increase of people that were raised by either a single parent. That the statistics, and according to the Census Bureau, says that since 1968, there's been an increase, 75% from 80% of kids growing up with mom and dad down to 75%.
And that's going to really alter that core belief system,
What lessons are they learning?
And like you talked about the formidable years, so high school, middle school, young men are becoming themselves, and the testosterone starts flowing.
Right.
It's really important that we instill, good habits, good thought processes, and good visions of who a positive, successful man in the community is. And that's what we really look forward to at Capital City Black Nurses, and just highlighting all the different avenues that men can grow up and be really positive in the community. Right. A barber, a photographer, a mental health professional, obviously nurses, physicians. But just creating that positive kind of role model that we all really need, and that really helps people with that foundation. Before we leave, I appreciate the insight. That was really good. Anything that you want to talk about or resources for people moving forward to work through gun violence with your history in the Army? You talked about the PTSD, but for those impacted, the gentleman earlier said that he just went to one of the funerals yesterday from the tragedy. What can people do as a mental health resource moving forward? Okay, so the county, the state, the government pays for programs to support people with needs like that. The county has a bunch of resources. If they can't provide the resources for you directly, with insurance and without insurance, there is something available for you. But just like you hear about in Alcoholics Anonymous, the first step is to admit that there's an issue. Sure. And that's where we come in short in the Black community, especially. We learn to just go and thug through this and get through this and make it the best way we can. But we're only human, and when you're happy, what do? You smile. When you're sad, what do? You frown. When you're stressed, what do? You go through it. It affects you physically. Definitely. It affects you emotionally. So resources are continue to look into your government resources. That includes with the county. There's a couple of websites. I'm not here to advocate for any certain one, but there's a big one named Psychology Today that a lot of people use, right? You're the expert, right? If you endorse it, a lot of our folks, we're looking for trusted voices, and that's what's really awesome about this platform is that you're getting information from people in the community. We're just regular cats that want to come together and make a positive change in the community, and that's what I really appreciate that. Absolutely. Yeah. My mentor in the mental health field is a Black female named Dr. Takla, and she's from East Oakland, and she's a doctor and has
couple of licenses, and it's very known. And I, you know, there's not that many mental health workers, black of color, let alone male mental health workers of color. So anything I can do to help make that different, you know, and I appreciate the Black Nurses Association, and I think we've had some good conversations about this before.
We'll be working together.
Absolutely, looking forward to it. Looking forward to it.
Travis, I appreciate you. Thank you all for continuing to stay with us. We really appreciate you all tapping in with us for our Barbershop Health Talk 2022. We've learned a lot, we've grown a lot, and we've worked through a lot. Gun violence is something that afflicts our community more than others. We unfortunately know it's going to happen again, but we know after this time with us, we'll be better prepared and better have more resources to work through it. So I want to give another shout out to our sponsors, UC Davis Health, our co-collaborators, Brother Be Well Project, Trap Medicine, Lula, Lift Up Love Always, My Brother's Keeper Sacramento, everyone that's been involved, coming to you here from exclusive barbershops and here in Oak Park, Sacramento. Take care.